treatment?
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's non-enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you are taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwede sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga pagsagot sa mga questions. Basta nasasayahan ako. Ganun.
We're always with you from start to healing!
Magandang araw po sa inyong lahat. Ako po si Ciela, ang inyong host, at narito po tayo muli sa Simply Nature Success Stories. Napakapalad po natin ngayong araw dahil napaunlakan po tayo ng isang lung cancer patient na may very inspiring story na ibabahagi po ngayong sa ating lahat. Magandang umaga po, Ma'am Violeta. Salamat po sa pagpapaunlak niyo sa amin ngayong araw na ito. Maaari niyo po bang ipakilala ang inyong sarili sa atin po mga manonood?
Okay. Sige, salamat sa inyo. Ako po si Violeta. Magsi-67 years na ako. Na-diagnose po ako nagkaroon ako ng lungs cancer na stage 3C. Halos stage 4 na daw yun. Ay, nung 2022, nag-ubo-ubo na ako pero gumaling. Tapos nung 2023, inuubo na naman ako. Hanggat sa ang plema ko is may dugo. Hindi ko yun sinabi sa mga anak ko. Nilihim ko yung gawa nga ng akala ko TV lang. Mga buwan ng May, sinabi ko sa kanila. Alam naman nila yun na ubo ako eh. Pero sabi ko, hindi na maganda. Ang sabi ko, may dugo na yung ko. May dugo na yung plema ko. Di pina-x-ray nila ako, mayroon ng findings na mayroon bukol ang lungs ko. Ang ginawa naman ng doktor, naman ako, CT scan with contrast. Yun nga, nakita mo, bukol sa sa lungs ko is malaki na. Hanggat sa napansin ko naman na mga buwan ng June o July, mayroon na ako nakapa dito mga bukol. Sa liig ko binayopsy. Hanggat sa dumating ang result ng biopsy after 2 weeks, hindi na maganda. Dahil nga mayroon akong lungs cancer, stage 3C. Ayaw ko kasi nagpa-chemotherapy noon. Pero dito sa bahay, nagpakuha ako ng oxygen tank, malaki. Hindi na ako nakakakilos kasi noon eh. Halos nakahiga na lang ako, pupunta ng CR, pagbalik ko, salpak agad ng oxygen. Dahil sa grabe na nga. Talagang ang isip ko, kung anong gamot ang makakalunas.
Kayo po ay gumamit ng Simply Nature PPARS. Ano po yung mga naramdaman yung kakaiba o pagbabago?
Nung dati pa man, bago ako binayopsy, na nagsisimple nature na ako siguro mga mahigit ng 1 buwan, maganda. Dahil yung dugo ng plema ko, nawala doon sa PPARS liquid. Nawala yung dugo. Hanggat sa ma-biopsy nga ako, mabigyan naman ako ng yung gamot ng biopsy, magaan-gaan na magaan-gaan na ang pakiramdam ko kasi wala naman ng dugo.
Naisabay po ninyo itong Simply Nature PPARS dun sa GPT po na yung targeted therapy po na nasabi ninyo kanina. So, nagkaroon po ng magandang improvement sa loob po ng isang buwan, tama po?
Mula nung mag-PPARS liquid ako, na mga nakakailang box ako, nawala yung dugo sa plema ko. Yun naman ang guminha-ginhawa ako. Hindi, ang pagdating ng result ng biopsy at naresetahan ako ng gefitinib, ang bilis lang. 4 na beses lang akong nakainom. Nawala na yung ubo ko, nawala na yung plema ko.
Para po sa kaalaman ng lahat, ang isa po sa maganda sa Simply Nature PPARS is kapag po ito ay naisabay sa conventional treatment, kagaya po ng chemotherapy o kaya po prescription medicine po na prescribe po ng mga oncologist, ay may pagkakataon na mas napapalakas po natin yung bisa or yung effectiveness po ng mga gamot na ito at mga treatment na ito, lalo na kapag kasabay po ng PPARS. So, I think ganun po yung nangyari po sa inyo.
Kasi bago pa man ako na diagnose ng may lungs cancer ako, ayon doon sa biopsy, nainom na ako ng PPARS liquid, saka PPARS ng tablet. Nawala yung plema ng dugo ko. May 1 buwan na rin. Ang ganda ng epekto sa akin. Ang sigla ko na, 1 buwan, 1 linggo, hindi na ako nahingal, hindi na ako nag-o-oxygen.
After po nun, so nagtuloy-tuloy po kayo ng gamit din po ng Simply Nature PPARS?
Hanggang ngayon, nag-Simply Nature pa rin naman ako for prevention na pampalakas din ng resistensya. Hanggang ngayon, nag-iinom pa rin naman ako.
Pati po yung mga nodules o yung kulani po ninyo, o bukol sa leeg, ay nawala.
Nung nainom na ako nung gefitinib, yung mga bukol dito nagdamihan, ang dami po na talaga dito ng bukol. Awa ng Diyos. Unti-unti na rin yun, araw-araw, kada umaga, kinakapa ko ang liig ko na wala. Pero tuloy-tuloy pa rin naman ng inom ko nung PPARS kasi yun nga ang nakakaganhawa sa akin. Pag nakakainom ako noon, medyo malakas, parang maginhawa bang huminga. Kahit may iniinom naman ako ng hindi na ako hindi na ako nag-oxygen. Kasi nga maginhawa na ang paghinga ko. Hindi naman sa wala akong tiwala sa mga chemotherapy, pero ang dami ko na kasing nakikita na mas lalong daming naaapektuhan ng chemotherapy. Kaya ang ayaw ko talaga ng chemo, hanggat maaari gusto ko na lang yung alternative medicine. Yun na nga, di naman din ako nagpabaya na binibilhan naman ako ng mga anak ko ng mga daming mga herbal. Pero ang naramdaman kong mabisa o maginhawa sa pakiramdam ko ang PPARS. Kaya yun ang tinuloy-tuloy ko. Basta ako mahigpit akong sinasabi ko sa kanila, ayaw ko ng opera. Ayaw ko din ng chemo. Kasi hindi ko kakayanin na yun. Mag-antay-antay tayo ng panahon kung i-effective itong kasi ang tinira ko na lang, hindi na ako nainom ng iba pang mga alternatives. Sabi ko, ito na lang, dahil ito ang nakakaginhawa sa akin, PPARS nga.
Last January, nagkaroon po kayo ng CT scan. Ano po yung dumabas na sa CT scan ninyo netong January po?
Sa CT scan nitong January, ito lang 2024, is maayos na. Hindi na, wala na yung mga bukol. Kasi kahit si Doc Jansen naman noon, gusto niya na rin ako ma-CT scan para daw malaman, curious daw siya kung ano daw yung nangyayari na sa bukol ko. Maayos na, wala na yung mga bukol. Parang cavity na lang daw yung naiwan ng mga pinag-alisan ng bukol. Yun.
Dito po. So parang ito yung naging resulta po, nung pag-combine po ninyo ng PPARS at saka po ng GPT po this past months po. ano po yung mensahe na pwede nyo po maibahagi sa kanila sa mga katulad po ninyo na nasa kalagitnaan po ng cancer journey?
Laban lang. Huwag tayo mawala ng pag-asa. Ang cancer, nagagamot. May Simply Nature, may PPARS, maganda. Yun talaga ang naranasan ko na guminhawa talaga ako. Nung medyo inatake ako ng todo, gusto ko uminom kaagad, kaso lang kaiinom ko lang. Dahil yun ang maginhawa sa pakiramdam ko na. Pag inuubo ako, nakakaginhawa naman talaga.
Ma'am Violeta, maraming salamat po sa pagpapaunlak niyo sa amin at pagbibigay po ng panahon para maibahagi niyo po yung inyong inspiring story po no sa ating mga kapwa-pasyente na nasa kalagitnaan o may pinagdadaanan din pong laban against cancer.
Ay, ako si Violeta, 67 years old. Na-diagnose po ako ng lungs cancer, stage 3C. Dati po, hirap ako sa paghinga, naubo, at ang plema ko lumalabas, maraming dugo. Talagang hindi ko na rin alam kung paano. Nung mag-take po ako ng Simply Nature's PPARS liquid at PPARS tablet, maginhawa po ang aking pakiramdam at nawala po ang dugo. At sa ngayon, hanggang ngayon, maayos na po ang pakiramdam ko. I trust Simply Nature. Maniwala po tayo.
Welcome to the innovative modalities in cancer treatment.
The 5.9 centimeter mass was gone. I was actually, at this point, I was surprised myself, no? How can it happen in just a span of 1.5 months? So I asked them, what did your uncle say about this mass? Their uncle said that, yeah, indeed, the tumor was gone. It's just a cavity. It's not enhancing. So, it worked. Okay.
Right? Now you know. Cancer eats what? Cholesterol. Right? Simply Nature people can lower what? Cholesterol. Now you understand why you are taking the tablets? Make sense? Yeah, so more powerful than I tell you this miracle product. Just buy, eat, cure. No, we shouldn't do that, right? Because cancer is not a stationary disease. It keeps changing. So it's best that you understand what's happening. All right?
Especially if we are talking about solid tumors, the number one modality of treatment is surgery. Then to prevent recurrence, then we do the other adjuvant treatments like chemotherapy, immunotherapy, or targeted therapy, and also radiotherapy.
I have learned the innovative modalities that can be offered to my mom. Tapos on how to take care of ourselves also. Siguro si mom pwede sa powder, ako po pwede sa PPARS Plus naman.
Yes, I will invite friends and family members na umattend sa ganitong klase ng ano. Kasi masaya ako eh. Para bang ano, kasi masaya yung outcome, yung staff, helpful, friendly, plus yung yung panelist responsive sila sa mga tanong. Tapos very honest sila sa mga pagsagot sa mga questions. Basta nasasayahan ako, ganun.
We're always with you from start to healing.
live. Hello, everyone. I am Jhen, and welcome to another enlightening episode of Simply Nature webinar. This program is brought to you by collaborative efforts of Simply Nature International and Simply Healed Medical Group. Just a quick recap, last week, July 18, we discussed cancer. Can I inherit it? Lots of questions were asked and most importantly, answered by our experts. But tonight, we will discover how cancer patients can benefit from using PPARS, because tonight's interesting topic is entitled Facing Cancer Diagnosis Head-On, Benefits of Taking Immediate Action. And tonight, we will explore the latest advancements in early detection techniques that can significantly impact treatment outcomes. Understanding the early signs and symptoms is key to prompt intervention, potentially saving lives and improving diagnosis. So join us as we delve into proactive measures and empower you with knowledge to navigate the journey from diagnosis to treatment effectively. We extend our sincere gratitude to each and every one of you for tuning in to this 172 webinar, and we encourage you to share this online event with your friends and loved ones who may benefit from the insights shared here tonight. And without further ado, let's dive right in. Please note that we will be having an Ask Me Anything portion later on, so feel free to drop your questions in the comment section. And leading our discussion tonight, our distinguished health experts. First, I'd like to introduce a successful entrepreneur and seasoned international speaker on topics ranging from personal success to healthcare. He is the CEO and founding director of Simply Nature International, Mr. Shyan Lim.
Hi,
Hello, Sir
Jen, and
Shyan.
good evening to everyone. Welcome to our 172nd episode. That means it's months worth of consecutive programs. So in Philippines, we're undergoing a typhoon, but we are still doing our program. So to all those who are being affected by the typhoon, our heart goes out to you. I'm glad. Do keep safe and keep warm and dry. Tonight's episode is really great because we'll give you a insight to what to do after you've gone for your diagnosis, right? Or whether you need to go for a diagnosis or not. So prepare your questions. We'll answer them after this short discussion. I'll hand the time back to Jhen, who will introduce our speaker for tonight.
Yes, and now on to our next health expert. It's an honor to present our esteemed speaker, Dr. Jansen Calalan, a distinguished graduate of St. Luke's College of Medicine. Dr. Calalan is a diplomat of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Calalan specializes in the treatment of cancer and metabolic illnesses. Please join me in welcoming Dr. Jansen Calalan. And let's hear from our expert. Let's all watch this.
Follow up with your own goal, please, okay? Because you need to get treated. So whatever treatment it may be, whether it's surgery, chemo, radiation therapy, immunotherapy, targeted therapy, or natural therapy, okay? So you have to get treated, and don't just focus on one treatment and forgo all the others, because all these treatments complement each other. The goal of these treatments, the combination of these treatments, is to give you the best outcome possible.
Hi everybody, welcome to another episode of Simply Healed. Today's episode is going to be so helpful for patients who've been just diagnosed with cancer. We're going to answer that all-important question, but before that, let me welcome Dr. Jansen. Dr. Jansen, welcome back to another episode of Simply Healed.
Hello, Shyan. Hello, everyone. Happy to be here again.
So tonight, we're going to talk about actions to do after diagnosis. So you've been diagnosed with CA. That is a very serious diagnosis. You are probably stressed, feeling very strong emotions, and your family is probably also feeling very strong emotions. At this time, panic should not be the thing that you do. What we always want to share with you on Simply Healed is that there is hope, all right? And if your diagnosis was in the early stages, stage 1 and 2, for many cases of cancer, you are going to get well. So if it's stage 1, for most cases of common cancer, the recovery rate is in the 90 percentiles, which means you are going to get well. So if it's the 3rd and 4th stage, then this Tonight Show is very important. You have to know exactly what to do immediately, even before your next appointment with your doctor. So, Doc, what do we do when we are diagnosed with cancer?
So it's very understandable that it can be so overwhelming. No? You don't know what to do, and or there's so much to do that you don't know where to start.
Yes, and sometimes the worst part is your doctor may not have spoken to you a lot.
Yeah, a lot.
They just tell you, I'm going to treat you, don't worry, you have prostate cancer stage 1. And then that's all he says. And he told you not to worry. But you're worried because that's all he said.
Exactly. So sometimes it can be, why is my doctor only told me this? Something's wrong. But you know, I mean.
So tonight we have an AMA Ask Me Anything segment after this. So we are here to answer all your questions that you forgot to ask when your doctor gave you your diagnosis. It could have been just yesterday or some time ago. So tonight, just take the opportunity, stay with us until the end of this segment, and we will move to the live Q&A, and you'll be able to ask all the questions so that you're clear on what to do.
Okay, so what I did was to create a checklist for you. So this is how you should go about, this is how you, in general, this is how you should approach after you get diagnosed with cancer. No? So number 1 is to change your lifestyle immediately.
I like this, Doc, because changing your lifestyle is not dependent on the pharmacy or the doctor or the hospital. It's literally the moment you know you have cancer, this is what you can do for yourself, right? I see here the normal advice of diet, exercise, and positive psychology. I want to say this diet thing, you know, Doc, because sometimes, I mean, we meet many patients, and many patients actually, I just met with my neighbor a few weeks ago, and she was diagnosed with breast cancer, and she was going for chemotherapy. And her doctor, her oncologist actually told her, well, as long as you're going for the chemotherapy, you can eat anything. And immediately, that was not, she knew in her heart that was not right, because her mother had breast cancer and her mother watched her diet and changed her diet. So, Doc, I just exchanged Viber messaging with her. So I just want to share with you some good news before you even continue. Her doctor said she could eat anything, right? And I talked to her and said, no, you can't. Why? You got breast cancer because you had the wrong lifestyle. So the lifestyle caused the cancer. Now that you do have cancer, that same lifestyle is going to make the cancer worse. So you got to meet Dr. Jansen. So I arranged for her to meet up with you. And this is what she told me. She's now able to sleep. She had to take sleeping pills while she was on chemotherapy because she couldn't sleep. So I can imagine you have cancer and you can't sleep. How tiring. It's like tiring upon tiring, right? Yes. And then she was not always feeling weak. And then she was confessing to me, now she's eating healthier. And she was also on some protocols like PPARS protocol, and she can sleep.
Wow.
Okay, so that to her is amazing. So she said it made the protocols, the advice, the change in lifestyle, the PPARS protocols made significant impact on her chemotherapy. So there you go. This is something that you can do immediately for yourself, independent of your next hospital appointment or appointment with your doctor. Yeah, Doc, maybe you elaborate a little bit more.
Yes. So now, of course, you just got diagnosed with cancer. So immediately, you do whatever you think is healthy to do. Okay? So that's right. Changing your lifestyle. You be proactive. Okay? You don't wait for your doctor to advise. Now, of course, we have to optimize. So this is the time that you follow up with your doctors. Your lifestyle medicine doctor, yours truly, and then your on-go. Okay? Very important that you follow up with those two. Okay, so number 1, on my part, my role is to optimize the food that you're eating so that you will be more guided, it will be more structured. So you know where to source them, you know how to prepare them, and for the more nitty-gritty part, just to guide you on whether or not this product is okay or this product is not okay. Right?
Doc, you're being too modest. You know, honestly, Doc says that he's there to monitor, to optimize your nutrition. But if you really understand what Dr. Jansen is really doing for you, what your lifestyle medicine doctor is doing for you, is that he is taking care of the rest of your body. So remember, normally people won't have 7 specialists because the medical bills will scare you as much as the cancer. So I understand. So normally you have an oncologist, and you would ideally want at least a lifestyle medicine doctor or a doctor like Dr. Jansen. Why? Because the oncologist, your onco, is a specialist focusing only on the cancer. He's focusing only on the cancer. But when you fight cancer, you gotta make sure your kidney is functioning, your liver is taken care of, so that all the waste material, toxic material that comes from fighting cancer and from, example, chemotherapy, the toxic substances that your body reacts from radiation therapy, all these needs to be displaced by your liver, your kidneys. Your lungs have to stay healthy. Your heart has to stay healthy. Your bone marrow has to stay healthy and not be damaged by the chemotherapy. All these things are important, and no one's looking at it because your onco is really not looking at it. He's very highly trained and is a specialist in treating the cancer. He's not thinking about how to take care of your kidneys, and if that is an issue, he will probably recommend a nephrologist to be part of the team. But like many people who go for cancer treatment, having a team of doctors sometimes is pretty scary. Yeah, it could be confusing as well and sometimes intimidating. So at the very least, have a doctor that supports all the rest of your body, and let the onco focus on the cancer. So that's a very important, very important approach to fighting cancer. Yes.
Okay? Now, next, you go to your onco. Follow up with your onco, please, okay? Because you need to get treated. So whatever treatment it may be, whether it's surgery, chemo, radiation therapy, immunotherapy, targeted therapy, or natural therapy, okay? So you have to get treated, and don't just focus on one treatment and forgo all the others, because all these treatments complement each other, okay? The main goal of these treatments, the combination of these treatments, is to give you the best outcome possible, okay? So it's very important to undergo the treatments that are recommended by your onco. And then what your part is to watch out for the side effects. If you feel the side effects, follow up with your doctors. Okay?
How important is managing side effects?
It's very important because sometimes it is the one that determines whether or not you complete the protocol or not. And completion of the protocol sometimes, not sometimes, always determines whether your survival rate is high or low, or whether or not the cancer recurs.
You know, and this is important. So number one, side effects are important to monitor. You know, if you can't eat, you don't have energy. If you don't have energy, cancer is actually a disease, an illness of starvation, because your cancer cells are stealing nutrients from your healthy body. So if you're not eating, that's not good, right? So these side effects are critical. You know, just having a low appetite is not something to ignore when you have cancer.
Yes.
You know, I remember one of our programs, you said, cancer patient, you said, first thing, you eat a lot. I mean, that's a very mundane advice, but it's very critical and important for cancer. But some other more serious side effects could be like your red blood cell count is dropping. Your white blood cell count is dropping.
Yeah, because of the chemo and the RT.
And if it gets low enough, you can't continue with your treatment.
The onco will stop the treatment because your body cannot handle it. So we would have to wait further for your body to recuperate enough for you to continue the treatment.
And if you wait too long, the cancer
Sometimes
might mutate.
And sometimes you're back on to square one. So
Yes.
that's
So you don't want to lose momentum when you are fighting cancer. So it's so important to take care of, have a specialist like Dr. Jansen taking care of the side effects of the cancer treatment that you're going through. But down here, you know, you are a lifestyle medicine doctor. So in your protocols, you don't prescribe drugs.
I don't.
So it's kind of, I'm sure some of the viewers are thinking, you don't prescribe drugs, but all you are talking about is chemotherapy, radiation therapy. So why not just natural?
Because sometimes natural treatment, although yes, there are some few cases that natural therapy works, but however, these are the minority. Okay, the majority of patients is that doing natural treatment alone won't work. Okay,
And I want
you
to,
have to combine everything.
correct. And I want to say to everyone, if you asked me 5 years ago, I'll be pro-natural. I'll be very, very pro-natural because I have this idea that the treatments, chemotherapy, radiation therapy, do as much harm to me as the cancer itself, right? But today, knowing Dr. Jansen and new developments in our protocols, the PPARS liquid extracts, we are able to manage a majority or the major parts of the side effects of chemotherapy and radiation therapy. So then I look at this radiation and chemotherapy with a different light because I have also seen many people go natural and then they die. They die from cancer, right? Then there are people who went for chemotherapy, the cancer died, but they died from the side effects of chemotherapy. But here it is, you see, if you go natural, you die from cancer. If you go for chemotherapy, you die from the side effects of chemotherapy. But here, what if I can manage the side effects of chemotherapy? Then the cancer dies and you are alive because we can deal with the side effects of chemotherapy. But if you go for natural, if it doesn't work, then you die from the cancer. So when I look at it this way, suddenly my whole view towards treating cancer is also different. And I've also realized, Doc, this last few years with climate change, that affected our food supply. So the quality of the vegetables, everything that you eat, the quality of the air. Now we have crazy temperatures. When it's supposed to be cold, it's hot. So I look at it and I say the natural world is not ideal, especially if you live in a city, having to have work in order to pay for your expensive organic vegetables that you're eating for cancer and medical treatment. And we have many patients have children to look after. So we don't live in an ideal, in a farm world out there with super clean air. Pollution is really bad all over the world, even the air that we breathe. So suddenly I realized, there is a lot of common sense that we don't live in an environment where just going natural will work.
Correct.
Correct?
Then one of the good news is as well is you'd be worried of side effects of chemo. No, majority of my patients are actually worried. I don't want to go for chemotherapy, doc, because of the side effects. I always.
But now they're all happy because their tumor is gone and
yes.
The side effects were not as bad as they thought.
Not as bad because I always give Simply Nature PPARS to manage the side effects. So it's one of my strategies that now you know how. Okay.
Now you know how.
So okay, now you got treated. Now that you are on remission, what do you do next? The fight doesn't stop there, okay? You're still not out of the woods. All right? So now we go to post-treatment care. So for post-treatment care, you continue with your lifestyle change because more often than not, the food that you eat is the one that triggers your cancer coming back. Okay? So that's very important. You have to be consistent. Number 2, continue with the natural treatment. And lastly, we just monitor. Take a look at the imaging, take a look at the tumor markers. Okay? So that's how we approach
treating cancer. This is a checklist. This is what you do after you've been diagnosed cancer. Doc, just yesterday I had a conversation with a patient all the way in the United States. And the patient was very, very happy because this is a wealthy patient, so he had many doctors. But he found that me, not a doctor, a research expert in PPARS, actually gave him a clearer picture of how to fight cancer. Because I went to him and showed him the whole approach to fighting cancer, which is number 1, get yourself strong. And straight away from day 1, the moment you are diagnosed with cancer, we are already preparing you for after the surgery, after the chemotherapy, what to do next. The whole process we don't just stop at the chemotherapy. We look at the whole process all the way to the 5-year mark. So we are thinking, I explained to him, it is so important to take care of your body while you're going for chemotherapy, because if you do that, then your immune system is intact after the surgery and after the chemotherapy, and your chances of getting second bout of cancer is reduced. So even from day 1, we are already reducing your chance of your cancer coming back. Because doc, when you did that special on cancer recurrence rate, my jaw dropped. You know, viewers, did you know for ovarian cancer, 85% on average, 85% of people who have ovarian cancer, the cancer will come back. So how can you go in treating ovarian cancer without straight away thinking already about the minimizing the recurrence? And this is why I hope today's program gives you a complete picture. And I can see right now, your questions are pouring in. Maybe what I said is triggering some questions in your mind. So Doc, anything else, or should we move to the AMA?
Yeah, I think we should move to the AMA already. I see a lot of questions coming in as well.
So let's move to our Ask Me Anything segment.
So at this point, questions are very much welcome. Just type them down in the comment section below, and kahit Tagalog, okay lang po. Okay, but just before we go to our AMA or Ask Me Anything portion, quickly, I just want to greet our avid viewers, Miss Florentina Baino Olivares and Edna Alarcon Corpus Aveo, Mavs Agot, okay? Enjoy Kakayan Cabrera. Thank you for coming, and webinar is not the same without you. Now, to answer all your questions in this modern world filled with noise of different health opinions, only trust the ones from the experts. May I call on once again Mr. Shyan and Dr. Jansen Kalalan.
Good evening, Jhen, and good evening, Doc. Good to have you here with us again, Doc.
Hello everyone. Happy to be here.
Yeah, let's go into the questions, Jhen.
Yeah, let us start the AMA or Ask Me Anything portion. First question coming from Miss Florentina Baino Olivares. Actually, this is not about cancer, but these are unanswered questions from the past webinar.
Okay.
She's asked, I am CKD2. Is it okay to take PPARS?
Yep. CKD2 is CKD stage 2, no? Yes. At this point, the CKD that you have, there's still hope of reversing it. So please do whatever you can, no, to stay healthy. Okay?
Yeah, I want to say that, kidney is one of the most important organs. One that is destroyed, quality of life is very, very difficult. Even with transplants, transplants can only last 5 to 10 years before the body finally will reject it too. So take care of your kidneys, right? So one thing really good is PPARS is actually great. It's like, if I put it in layman terms, it's a kidney aid, right? Liver aid and kidney aid. So it's going to be good. It's good for you. If you want to know more, simply type in your question. And I'm sure Sheila, Jhen, or Beth, or if you want to have a consult with Dr. Jansen about your CKD condition and what you can do to improve it, please go for a consult with Dr. Jansen.
All right, next question from Miss Lovely Jane from Cavite. How to handle anxiety since I am afraid to know the truth of my lymph nodes in my buttocks?
No, maybe we start with like, even if it's the worst information like cancer, when detected early, what's the overall chance of overcoming cancer if detected early?
Depending on the cancer, if detected early, well, the most common ones, no, the survival rate after 5 years is 80 to 90%, at least 80 to 90. So this means that 80 out of 100 people will still be alive after 5 years. The more, yeah.
No, so I
this
just want to ask you that because I think that's the first step to anxiety. Yeah, it's better because if you know early, your success rate is going to be very high. But if you delay, and then later it's so big, it's so painful that you have to go and check it out, then it'll be too late. So why don't I'm just giving you information so that you can feel more, I think, positive about going to have it find out what it is, because the success rate is so high, even if it's the thing that you are afraid of. Yeah, Doc, any other advice? How do you help patients, overcome anxiety with diagnosis? My mom is like that, the old generation, they rather not know, don't want to go hospital, don't want to know. Okay. Yeah.
Well, the first step is of course to assure them. No, assurance is always the first step if the patient is anxious. No, when it comes to knowing what their diagnosis is. However, the fact that they're in my office already, I think to some degree they've overcome this anxiety. There are people who don't even want to step into a physician's office. Yeah, personally, I know of such people. No, um, one tip. Well, if you suspect that you have cancer, or yeah, if it's the thing that you're really afraid of, no, knowing it early on will give you the most chance of survival, because then you get treated immediately. Okay. um if it is not cancer, if it's something benign, yeah, I mean you're being anxious for no reason at all. So just imagine, you know, the all of the emotional stress that you're experiencing right now. So it's really better if you know what's going on inside your body early on, because there's only good things that will happen. No, yeah.
Okay. More questions about kidney. For a patient undergoing dialysis, this is from Willie Miraflor. Is it okay to take PPARS powder?
Yes, yes. I think PPARS powder is the one that Simply Nature recommends.
Yeah, that's the one that for dialysis patient, we recommend powder over the liquid because the powder has less minerals. So for dialysis patient, that will be just generally just better. Yeah.
So just continue. You're taking the right PPAR product. Okay.
Yes.
Next, from Miss Edeline Jumadil. 10 years post-mastectomy, is there a possibility the cancer will recur?
Yes, there's always this possibility, but it varies in rates. No, it's case to case. If you had your mastectomy early on, so when the cancer was diagnosed on an early stage, then you had mastectomy, and you also underwent all the necessary treatments in accordance to your staging, then the chances of recurrence at this point is really quite low. Yeah. There are patients who don't have any recurrence at all during their entire lifestyle, during their entire the remaining during their the remaining life, no, their entire lifespan. So better to detect cancer early on, really. So this is very important actually, and this I will emphasize further on Saturday's discussion. I will show information, a little bit of information on on different statistics, no, comparing patients who undergo surgery versus those who don't undergo surgery. Um, the the difference in survival rate is actually quite striking.
Yeah, so again, a reminder to everyone, if you want to meet Dr. Jansen, myself, and also our surgical oncologist, Dr. Jimmy, in person, together on come and see us, come and join us on our SMX conference on Saturday morning. All right, it's SMX Aura in BGC. The typhoon will be out of the country already, hopefully by tomorrow.
Yes.
So that'll be a great way to have a break as well, because after that you can enjoy SM Aura. That's where the SMX Aura is located. All right, so bring yourself and your family. Come and have all your questions answered.
Yes, and for those who will be joining us on site, there are lots of exciting exclusive promos awaits. So after the SMX Aura convention, you can just go to Cultura because you have a discount. Just claim the voucher at our registration booth, okay? Okay, next question from Rodel Zabala. My mother was diagnosed with rectal mass with malignant features. So what would be the best modality to be sure if it is cancer or not?
The rectal mass with malignant features, I don't know how you got this description, but the best modality to the site of the cancer is biopsy, because with biopsy they get a piece of the mass itself, then they look at it under the microscope. So biopsy is the confirmatory test to diagnose cancer. Okay. Aside from biopsy, we have tests such as the modalities. These are just tests to point us to a malignant or a benign direction. Okay? So, yeah. Biopsy is the confirmatory test that you have to undergo.
Okay, so I hope that clarifies. Okay, the one who asked if a PPARS powder is okay for dialysis patient. Now he is asking, is there Simply Nature products in Canada?
Oh, yeah, you can order from, okay, just ask the query there in Messenger. We ship directly to Canada. All right, so we have clients and patients who have done this successfully. Actually, we ship to Europe as well, even to Middle East. So yeah, even Australia, which is very difficult. I think we have had clients and patients successfully bring the product there. So yes, we can. It's available. It's available.
Yes, so please approach any of our client service officer, including me, Ma'am Sheila or Ma'am Daisy, and we will direct you to our official website, which is www.simplynature.asia. Okay.
Yeah, correct. Because normally on our program, those who are in Asia will get from international orders will get from our Shopify website, and of course, those who are living in Philippines actually get it from Lazada Philippines. Those who are in Singapore get it from Lazada Singapore.
Yes.
So, yeah, but those in Canada, they'll be from our official website. Yeah.
That's correct. Okay, next question. How can early detection through screening programs improve outcomes for cancer patients?
Oh,
Wow,
it's
Doc.
immense. It's immense. It's immense. It's immense.
World of a difference,
determines, yeah, it's a whole lot. It's a big, big difference. To the point that early detection, the screening process, if it is not in place, no, the screening programs that we have nowadays, if they are not there, there will be way, 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 way more cancer patients who will die. Yeah, yeah, yeah. It it determines life and death actually. Yeah, I've had a lot of patients who are still alive now because and they are in remission, okay? Because they were able to detect the cancers, their cancers very early on. So some were stage 0 cancer, some were stage 1 cancer. So yeah, they did their due diligence. Yeah, and they were quite active when it comes to their screening procedures, no? So kudos to those patients of mine.
Wow.
So do go for your health screenings, especially if especially those who come of certain age, like for me. I'm reminded I'm turning 50. So first prostate exam.
Good luck, sir.
Yes.
Yeah, I will not go to Doc Johnson. I'll go to all right.
Okay, next question. How do genetics and family history impact a person's risk of developing cancer?
Oh, so such a good question, Doc.
Yeah. It depends on what type again. If it is breast, then it is one of the major risk factors. One example is BRCA1, BRCA2 mutation. So this is passed on through your genes, no? So this is hereditary, and if you have a mutation on such genes, then you have a very high chance of developing breast cancer early on, and the breast cancer is quite aggressive. Okay. There are other types of cancers wherein even though there are genetic mutations, you don't we rarely see it come out, or we rarely see it come up. One such cancer is the cancer of the eyes, the congenital cancers, cancers that occur when you are still an infant. Okay. More often than not, no, these are acquired through the mother. Okay, the mother was exposed through some virus, to some chemical. That's why a reaction took place. No, genetic problems took effect on the fetus, which led the baby developing cancer. Okay, yeah. there are also colorectal cancer. No, colorectal cancer is also something that has a very significant genetic influence. That's why we screen for colorectal cancer at age 50. Prostate cancer is the same. However, for prostate cancer, since it is slow growing, even though in terms of genes, no, you can pass it on to the next generation since it's, but prostate cancer, since it is slow growing, it is one of the few cancers wherein your lifestyle actually has more impact than the genetic problem itself. Yeah. This is how genes play out in your risk for developing cancer. And just to assure you, okay, genes only play around 5 to 10% of influence, no, in developing cancer. Your environment, the environment in which you live in, your lifestyle still has the more significant impact. Okay, when the impact of the environment is at least 90 to 95% compared to 5 to 10% from genes.
I would like to add to Dr. Jansen's comment about how genes affect cancer is because one reason why genes only play such a small percentage is also because you have to activate your cancer genes in your body, right? So although the cancer genes is hereditary, is in your family history, it has to be activated. So it is actually most of the time is activated by your lifestyle. So the reverse is also true. You may carry a breast cancer gene, but if you don't activate it, so if you have a different lifestyle from your family history, you will unlikely develop cancer. So that's why, again, it's back to lifestyle. Of course, what we always hear and see is that if your grandmother died from breast cancer, your aunt, your mom has breast cancer, then there's a high chance you get breast cancer. The reason why people say it's a high chance because it's high chance that you live the same way your aunt and your grandma. So you're probably eating the same food, having the same lifestyle. That's why your cancer genes will more likely switch on. But as Dr. Jansen says, it is your lifestyle and your choices, and it can make a huge difference. So even if you do have cancer in your family history, don't worry too much about it. Instead, focus on living a healthy lifestyle. That includes not developing any metabolic syndromes, right? If you develop metabolic syndromes, the lifestyle that will make you diabetic and high blood cholesterol will also be the same lifestyle that contributes to you activating your cancer genes. So again, how do you stay cancer-free? Focus on the very basics, make sure you keep healthy by trying not to develop metabolic syndromes, diabetes, high blood cholesterol, hypertension. Just by keeping your focus on this, you will probably already eliminate most of the causes or the correlations that contribute to cancer. Right, Doc? Because people always ask you, Doc, how to prevent cancer? I think the first step is prevent diabetes and blood cholesterol.
Yes. Those are prevent the risk factors from happening in the first place. Actually, it's quite simple. The risk factors for developing cancer like hypertension, heart disease, no, diabetes, being overweight, sedentary lifestyle, the risk factors for developing these diseases are the same. Yeah, it's the same tips. Eat more vegetables, exercise more, rest more, worry less, drink more water, avoid processed foods, avoid eating junk food, these things, no? Yeah.
All right. Next question. Okay, what are the risks of delaying treatment once cancer is diagnosed?
Shorter overall survival, meaning the time that you live here in this world after your cancer diagnosis is gonna be shorter. And of course, complications which arises from the cancer itself are gonna be worse. No, one example would be a breast cancer, no, breast mass. It can eat through your skin, which can, once it eats through your skin will develop, of course, a wound, a non-healing wound, and that wound can become infected. I had one patient who who did not consulted any doctor, no? When she came to me, I was the first doctor that she saw. And when I looked at her chest, the breast was gone. It was eaten by the tumor completely.
Ouch.
Yeah. So yeah, it's a sight to see. Pardon for those who are still having their dinner, but yeah, it's not a good sight to see because the whole chest is full of pus. It you can smell the something rotting from across the room, no? So it's not a good it's not a good thing to have. So of course, do we still have any hope of treating the patient? Not anymore at this level because the entire chest was already eaten by the tumor. Surgery is out of the question. Chemotherapy will only do so much. So at this point, we just strengthen the body of the patient and that's it. Okay. So don't let your situation reach this point, no? Because when it reaches this point, there are very few things that we can still do to increase your survival, and more often than not, it's gonna be a gamble. It's still gonna be a gamble. Okay. Yeah. So that's coming from my experience. I also had other patients who died from infections, pneumonia, sepsis, brain abscess, these situations. Okay, so again, early detection is key. Please don't wait until you already are in this kind of situation before you go see your doctor. Okay. Yeah.
Absolutely. You know, any delay in the treatment of cancer is a bad idea. All right. So if you are afraid and like you find like the whole thing a lot of obstacle to go and take the next step, I would suggest arrange for online consult with Dr. Jansen, right? So is you don't have to go to the hospital. Sometimes, you know, I'm just going to say some practical things. It's also possible that you don't want to let your family members know, you know. You don't want to scare other people in your family. So sometimes, you know, I think the best thing that you can do is arrange for a consult with Dr. Johnson because you can go in the CR and take that call. All right. You can just go to your neighbor's house or go to a corner of your house, or when people's not at home, you can go and nobody will know that you travel to the hospital or something. That's the first step, right? And then straight away you can take action on your cancer. You know, Doc, I have a friend in Taiwan. He found out that he had tumors in his liver. So the doctor was not sure whether it's benign or malignant, but they still suggested that take it out, operate on it. And it makes sense because the liver is one of those organs, if you cut half of it out, in less than a year, it would actually have surgery on, especially if the position is operable. Guess what? Because he is in his early 60s, he was just worried about, you know, going to hospital and having a surgery. So he delayed. He delayed it like 3 months, thinking that should be fine, you know. And it turned out that his tumor was malignant. And then he lost weight. But the moment the cancer really set in, it only took like a month. He became like a mummy, seriously like a corpse, right? His skin was so tight you could see the veins and the bones. His entire pelvis, you can see it. It's as if like he was a skeleton. His face used to be round and full of he's on the heavyweight side, but he's so sunken, it's like a skeleton. And all this happened in a short time of like 4.5 months. It was just very, very surprising. So to everyone out there, the moment you are diagnosed, take immediate action. Do not delay, all right? Do not be afraid. Success rate is very high. if you take action. If you delay and it reaches, like what Dr. Jansen says, there are points where you cannot turn back anymore. All right. So please, everyone.
Okay, next question from Facebook. I am blessed. Is chlorella the same as PPARS? And can chlorella help lower high cholesterol levels?
Okay, Doc, let me answer this one. Okay, our PPARS belongs to the family of chlorella, but we are not exactly chlorella. We are a unique species of algae, all right, microalgae. So my Ninong is the one that created this unique species because he's like a botanist, right? So his job, his science, his research is to create new strains of algae. So of course, from the family tree, it's in the chlorella family tree. Okay, now next, what's the difference then between chlorella and Simply Nature PPARS? The difference is that chlorella does not contain PPAR agonists. Only our unique microalgae contains PPAR agonists. This is actually proven in court because in Taiwan, there were other people who claimed that their algae contained PPAR agonists. So we actually went to court and there was scientific studies, chromatography and all the other things to show that no, it is uniquely in our strain. So when does it make a difference between whether you eat chlorella and spirulina? Let me be like honest with you. If you're a very, very healthy person, then whether you take chlorella, spirulina, or Simply Nature PPAR tablets, you're going to see very similar effects. You're going to see very similar effects. But if you have medical issues like metabolic syndromes, like cancer and so forth, then the big difference starts to come in, right? That's where our microalgae actually contains PPAR agonists. So that's the major difference, right? So anyway, if you're going to take chlorella anyway, take the best in terms of microalgae, which is a Simply Nature PPARS. Okay, now, can our PPARS actually help with high cholesterol level? Yes, it can, right? It's actually something that we did a pilot human trial on, right? And that's how we discovered we contain PPARS anyway. We did a trial to show and prove that when you take Simply Nature PPAR tablets, within 3 months, you actually have an improvement of your cholesterol level. And here, I actually turn the mic back to Dr. Jansen because Dr. Jansen is very, very good at helping people treat their metabolic syndromes. He's so good, he's bored about metabolic syndromes. To him, it's a piece of cake. So, hey, Doc, you can share how you manage metabolic syndromes like diabetes and high blood cholesterol.
Yeah, I always approach this on multiple fronts. Okay, so of course, lifestyle change is a must because you cannot be on these supplements, even though it's PPARS. No, you cannot be on these supplements for the rest of your life. Okay, at some point, what you are doing should be able to sustain your healthy lifestyle. Okay, so lifestyle is a core. So if you have a high cholesterol level, it's always a plant-based diet that should be your diet, no? So it's a plant predominant diet, okay? Of course, we have next, no, we have to find out why your cholesterol is high in the first place. Is it because of the food that you're eating? Is it because of stress? Okay, because it's too much stress can also increase your cholesterol levels. Okay, why? Because cholesterol is the precursor of your hormones. If you are stressed, guess what? Your cortisol is gonna be through the roof. And a precursor of cortisol is cholesterol. Okay, so cholesterol, by the way, is produced by your liver. Okay, so our body makes our own cholesterol. Okay, so another one is family history. If your family has high blood cholesterol levels, no, we have something what we call as familial hypercholesterolemia, which is genetic. So this can also be a source. So we basically have to find out what the reason of your high blood cholesterol level is. Then we address that. Okay, but of course, there will be situations when your cholesterol is too high. We have to force it down. So we have to use medications. Okay, there's we can substitute the medications for herbal products. However, depending on how high your cholesterol is, sometimes we just have to pull it down quick because some patients I've encountered, their cholesterol is at 300 plus levels. It's gonna be dangerous if I let the patient be, no? So there's that, no? Of course, I also use Simply Nature PPARS. The therapeutic dose for this is 4 grams, by the way. 4 grams is around 20 microtablets. Okay, so sometimes, so that's the baseline. Depending on how bad the cholesterol level is, sometimes I even go up. And sometimes I even prescribe the extracts for this. Okay, so I approach it this way. Then over time, monitor the patient. When we, of course, during the first few months, no, we will see a drastic drop in your cholesterol because you are taking medication. Okay, so depending on how low the cholesterol goes down, we will first remove the medication. Then next, the supplements. Okay, because lifestyle and the supplements take time, no, before its full effect sets in. The medications, you'll see its effect in just a few weeks. Okay, so yeah, and of course, as you all know, and because yeah, as all of you know, there are patients who are quite reluctant on taking the medications because of the side effects. This is actually valid because statin medications, no, can damage your liver, and it can also break down your muscle. Okay, so that's why some patients who are on statins, they experience muscle aches, muscle pains, sometimes headaches. Okay. There are supplements that we can prescribe to mitigate the side effect. However, of course, again, you cannot be on these supplements for the rest of your life. Okay, at some point we have to wean you off them because, of course, finances. Okay, the supplements are quite expensive. All right, so basically that's how I approach things. So we monitor you every 3 months. If your situation is worse, then we monitor you every month. If your blood cholesterol levels goes down, we remove some of the medication, we remove some of the supplements until you achieve optimal levels without taking anything at all. Okay? Yeah.
There you
Okay,
go.
I guess that answers her follow-up question, which is, if an elderly is quite healthy except for managed BP and cholesterol by taking meds for them, can chlorella help too? So that's the answer na.
Yeah, the answer is yes. Take the Simply Nature PPAR tablets. You don't even, since you're managed with medicine, you don't even need to go with the extracts. Of course, if you're not sure, please type in additional questions and our CSOs will help you, or go for a consult with Dr. Jansen. He will guide you and monitor your blood pressure and guide you with your blood pressure and cholesterol so that you can wean off your medication, which is always a good thing.
So before we go to our next question, I just want to greet Miss Naomi Elona Vera. She says, good evening to all and watching from Bicol. Thanks for continuous educating us all. God bless.
Thank you, Naomi.
Ayan. Okay, pero ma'am, you're late ha. Just replay on our YouTube, okay? For the discussion you missed earlier. Okay, next question. What does BMA do for the patient? BMA meaning bone marrow aspiration.
Oh.
It's a type of biopsy actually. Bone marrow aspiration is literally, from the term itself, we aspirate the bone marrow. So we get a bone marrow sample. So what do we do with the bone marrow sample? We look into it. We look at it under the microscope to see how much blast cells you have. This is especially done for leukemia patients. Yeah. So that's the purpose of the bone marrow aspiration procedure. So from the bone marrow aspiration, we can diagnose, we can determine response type of treatment. Okay, so these three information, which are all very, very, very important.
Does it hurt, Doc?
Yes, it hurts. It hurts. It really hurts. In private hospitals, tertiary hospitals, we sedate the patient. Patients are put to sleep because it's really painful. Yeah. You haven't asked me how do we do bone marrow aspiration.
Okay, yeah.
Yeah, we basically open up your skin. Yeah, open up your skin. to the level of your bones. So that's gonna be a deep, deep, deep cut. Expose that part of the bone. Usually we expose the heads of the bone, no, the ends of the bone. So once it's already exposed, we drill through it.
Okay.
Yeah, so we drill through it. So that's like breaking your leg. No, I'm kidding. I'm kidding. Yeah, we're trying to break your bones, no, open up the bone so that the marrow inside, we can get, no, we can access the marrow inside. Okay, so that's how we do bone marrow aspiration. So after the procedure, of course, everything is gonna be put back together. So the bones, the open bones, no, the drill that they use, they're gonna put back that piece of bone. Then they're going to add bone samples, no. It's a medication that you put on top of the injured bone. It's like a cement. So the bones, how do I describe it? Okay, so imagine this is the bone, the surface of the bone, right? So you just got a piece of the bone out. So you put it back in, then you cement. Okay, then the bone is gonna fuse together. Yeah, okay, so we put that back in, then we stitch you up. So that's how we do bone marrow aspiration. So if you are awake and the doctors did that to you, you're gonna scream in pain. So usually patients are put to sleep, no, when doing bone marrow aspiration. Okay, yeah.
Doc, if there's a request for bone marrow aspiration, usually it's important lang, right? Because the doctor will not prescribe bone aspiration since it's such a procedure. They wouldn't do it lightly. Am I correct?
Yes, correct. We don't do bone marrow aspiration left and right. Okay, there must always be a very important reason why we are trying to do such a procedure. So usually the reasons are to diagnose, to determine treatment, and to determine the response to treatment. So these three.
There you go.
Okay. And speaking of bone marrow, and it's rainy. So, Doc, I was just thinking, is it true those who like to eat bulalo and like to eat the bone marrow, does it really help?
Help how?
Like increase your blood because you ate the
No.
bone marrow.
It's gonna increase your cholesterol levels.
Uh-huh.
Yeah, but not to increase the amount of blood that you have. No, the mechanism of action is very, very different.
Okay.
So
Going
it's
back.
not true. It's not true that
Yeah,
if
it's not
you
true,
drink more
guys.
blood, you drink eat bone marrow. Okay.
Okay. Next question from Facebook, Miss Jhen Chan Ang. What organ cancer or blood cancer is most difficult to treat?
Always the more aggressive ones. So for the brain, it's glioblastoma multiforme. That's I think the most aggressive brain cancer that a person can have. If you get diagnosed with one, it's almost always a death sentence, even though it's detected early on. The chances of recurrence is actually very high, even if you underwent radiation therapy and surgery for this kind of cancer. Another cancer that has very bad prognosis is anaplastic thyroid cancer. The prognosis is also not quite good. So I'm going to, if you realize, I'm going from head to toe. Okay. Yeah. So anaplastic thyroid cancer. So it's a solid organ cancer. Aside from the next to that would be your HER2 positive breast cancer, triple negative breast cancer. Those are two aggressive breast cancers as well.
Small
For
cell
the
lung
lungs, yeah, it's gonna be small cell lung cancer. So why is small cell cancer? Why does small cell lung cancer have a very bad prognosis? It's because it usually occurs in smokers. If you're someone who's smoking, your prognosis is gonna be bad already at baseline. Once you develop cancer, it's just gonna tank down. Okay. Going down to the abdomen, stomach cancer, gastric cancer to be specific, is one of the cancers that has also very poor prognosis. Gastric cancer, by the way, is very common in Korea. Next from that is pancreatic cancer. Pancreatic cancer is a cancer that when you develop symptoms of, it's already in an advanced stage, usually stage 3 or 4. Following that would be your
Liver cancer is difficult to
liver.
treat.
Yes. Liver cancer is also very difficult to treat, especially if you develop liver cancer on the background of hepatitis B virus. Okay. What else? Going down further, ovarian cancer. Ovarian cancer also has very poor prognosis, and the recurrence rate for ovarian cancer is very, very high.
30% if I'm around 30% if I'm not wrong. Yeah.
Yes. Okay, so that's for the solid organs. Also another one are the sarcoma. The sarcomas in the entire family of the sarcomas are aggressive. Okay. Yeah, that's also another type of solid solid tumors. For the blood cancers is also very difficult to treat, but between organ solid tumors and blood cancers is the more difficult one because you just simply cannot do surgery on them. So you would be relying on systemic treatment like targeted therapy, chemotherapy. So blood cancers is the more difficult one to treat in general. Okay.
I think you've listed almost all the organs in the body. I think the conclusion is cancer is not something that you want to play around with. Goes back to all the questions that we have had tonight. If you have cancer, if you suspect you have cancer, go see a doctor, because if you discover it early, it's not a death sentence, it's the reverse, right? It's like 80-90% success rate. Okay, even though we hear cancer so scary, the reason why cancer seems like a death sentence is because most of the time we discover it too late. So if you discover it early, it is actually not that scary. It's a 80-90% success rate, right? It's something that is definitely manageable, something that you can win. All right, so don't delay when it comes to cancer. Don't delay, always have it checked out. All right, and the easiest way to have it checked out is have a consult with Dr. Jansen, right? So that you don't even need to brave the weather, right? Even if there's a typhoon, you can still get it checked out. You can have a teleconsult with Dr. Jansen. Okay.
All right, we're almost at the end of the webinar. This will be our last 2 questions for tonight. Coming from Facebook, Miss Angelina Son. Good evening. Do we have a success treatment for stage 4 pancreatic cancer using PPARS? Thanks.
I haven't had a patient yet.
On that.
Personally, I haven't had one. Usually for stage 4 pancreatic cancer, it's almost always a death sentence already. Okay. Pancreatic cancer is actually the cancer that has the poorest prognosis among all cancers combined. Okay, especially at stage 4. I just don't know if Simply Nature has other doctors which had a good experience with pancreatic cancer.
Actually, it's also one of the more difficult cancer. I'm sure we have doctors that who have done well, but specifically stage 4, not to my knowledge as well. At this point, I would also want to encourage Angelina, if you're asking this because of some loved ones who is being diagnosed at this. It's not for cancer, for a cancer patient, it's not only treatment of the cancer, it's also palliative treatment as well. I just want to share like one specific. This is a patient who was ended up in a hospice, in a Catholic hospice, right? So it's basically end of the journey already. So the patient actually had, I can't remember what cancer, but it definitely metastasized to the brain. The hospital had discharged her. I think she ran up a medical bill of more than 6 million pesos. She was supported by her sister, who works as a nurse in the United Kingdom, so they could support the medical bills. Her brother was actually a priest, which is why she was actually in the Catholic hospice. So she was basically bedridden and not responsive. So my Lola, who was Doctora Angie Domondo, she's returned to the Lord and ripe old age of 90 plus. So anyway, my Lola was treating her at the hospice, and she used PPARS liquid on her. So the amazing thing is that the patient actually became lucid, sat up, and was talking normally when previously she was pretty much just sleeping and not responding. So this was very wonderful because her sister from the UK actually flew in, and she spent a wonderful 1 week totally lucid. And everybody thought, wow, she's going to recover. It was a miracle, really, because it was impossible already. And she had a wonderful last 1 week with her sister. They were able to chat and everything. And then after a week, she just went to sleep, and very peacefully she left. So I just wanted to say that even in the worst and most discouraging of prognosis, there are still things worth fighting for, and there are still things worth living for and looking forward to, even in the most difficult situations. So my heart really goes out to patients in those predicaments. But I want to say that, especially if you're Catholic or Christian, we know we will see them again. So take heart in that, and instead let's do what you can to make the last moments meaningful.
Thank you. I hope that gives some enlightenment. Okay, down to our last question. What PPARS options are available for cancer patients during and after treatment?
Oh, that's good, Doc.
I think all all the products that Simply Nature has. But but how I do it is I always put the patients on the tablets. That's the baseline because the tablets has everything.
Yeah.
The soft gel, powder, and liquid has the extracts at different concentrations. So how I do it is depending on how sick the patient is, I prescribe it accordingly. But say for example you are healthy enough, no? I give an example. I saw a patient a while ago, a patient who had just had her first cycle of chemotherapy. She didn't feel any side effects at all, especially at the first cycle. We usually see bad side effects already, no, at the first cycle of the patient, no. But the patient is quite strong, so I actually told her that hey, you can actually manage with just the tablets and the soft gel. But since you already purchased the powder, then just continue taking the powder. Yeah. So there was also one other patient that I saw earlier. The patient's prognosis is not that good already. They purchased the liquid. Okay, and that's also what I recommended for them to take. The patient is already on NGT, so the things that we give the patient has to be in liquid form, okay, for it to fit the nasogastric tube. So the liquid would in this case, no, the liquid is the way to go. There are also situations where when the patient cannot swallow, so that is when the powder will be best used. So really case to case, no, case to case, depending on the situation of the patient, depending on how well they can take the product, then I just adjust the number of pills or the number of scoops or the number of vials that I recommend for the patient to take. So basically, to answer your question, it's basically all the products of Simply Nature you can benefit from.
And to elaborate on Dr. Jansen's answer is have a consult with him so that you will get a proper understanding of what dosage to use. All right.
All right, it looks like we've covered all our questions tonight. So just before we say goodbye, can you give our viewers your parting words?
Doc, you want to go first tonight?
Yeah, sure. Thank you all of you. No, I just want to thank all of you first for staying with us until this time at night. I know there are a lot of you who had bad experiences with the typhoon yesterday. I hope you are safe. There are a lot of households where properties, assets were destroyed because of the flooding. Our sympathies are with you guys, and I hope you can recover fast, especially right now because there's another typhoon coming in. No?
Oh, really?
Yes, there is one low pressure area. It's not named typhoon yet, but it looks like it's gonna be a typhoon based on the satellite image that they showed in the news just a while ago.
Oh, no.
So yeah, so I hope and I pray that you can recover fast enough, no, so to get back on your feet immediately. And I just want to invite all of you on Saturday. I hope I can see a lot of you on at SMX Aura. If you want to learn how PPARS can help, know how well PPARS can help our patients, please attend. Please attend. So I'm going to present a very interesting case, a rare cancer at that, which turned benign and completely disappeared with PPARS. Okay, so I hope you can join us. So that's it. Shyan, the floor is yours.
Same to me. Thank you for joining our program. You made it. This is our 172nd episode. So it's because of all our viewers, So thank you very much. Again, would love to see everybody on Saturday. Hopefully that will be something positive after all the challenges we've had this last 2 days here in Philippines because of the typhoon. I think the typhoon's gonna end. This typhoon's gonna end tomorrow, hopefully, and that will be a good thing to get things started at SMX, and then you can also enjoy your time there at SM Aura after the event. Okay, you'll be seeing Dr. Jansen, myself, and Dr. Jimmy. The last time we had some really, really amazing questions and exchanges live during the Q&A portion of the program. So see you all on Saturday. Keep dry, keep safe. And we'll see you next week also on the program again. Good night.
All right. Thank you, Sir Shyan and Doc Jansen. We hope to see you again in our future webinars to come. Same day, same time, every Thursday night at 7:30 p.m. But before that, guys, I'm so excited. Just 1 day to go. This July 27, Saturday, we are calling all cancer patients, survivors, advocates. Let's all come together to beat the odds using medical nutrition, oncology, surgery, and PPARS in fighting cancer. And here's a special announcement for our existing clients and patients, especially those who have already used our PPARS extracts, namely PPARS Kid, PPARS Powder, and PPARS Capsule. Kindly approach your respective client service officer, including me, Mom Sheila, or Mom Daisy. We have a special treat for you, okay? And every health journey is unique, but you are never alone, and together we are stronger than cancer. You can reserve your seats as early as now via GCash payment. Just scan the QR code flashed on your screen right now. All right. Thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic diseases is what keeps us going. Here in Simply Nature, we are always with you from start to healing. Thank you, everyone.
Hi everyone! Have you ever wanted your oncologist, your surgeon, and your integrative doctor all on the same stage at the same time to answer your questions about cancer and your cancer journey? Well, the opportunity is now right here. It's happening. Simply Heal is going to have its second face-to-face event, Beating the Odds, Medical Nutrition, Oncology, Surgery, and PPARS in Fighting Cancer. So join us on July 27th at SMX Aura, 8 a.m. Click on the links below to register for on-site or join us via Zoom. See you there, July 27th.
Boost your health today with a Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS tablet for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Now is the best time to try our Simply Nature products. Available on our official Shopee, Lazada flagship store, our website www.simplynature.asia, and our office in BGC Taguig. Order yours today. Click the link on the description box.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Heal program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.